Hello and welcome to another episode of Rockford on the Record. I'm Wally Haas, your host, and with me today is Jennifer Cacciapaglia. Did I get it right?
Cacciapaglia.
In my previous life, I just had to spell names correctly. I didn't have to pronounce them, so she was youth director for the city of Rockford. This is our third episode of Rockford on the Record. If you have liked our content, our previous episodes were on public safety and neighborhoods. Like our content on YouTube or whatever platform you're watching it on, subscribe, do all those good things so that we continue to provide you content on this channel. So, Jennifer, when I think of youth programs, normally I think of the Rockford Park District. How does the city get involved with youth?
So in January of 2018, we first opened the office through the authorization of City Council for the Mayor's Office of Domestic and Human Trafficking Prevention. And we began to analyze our data around that. As many people know, nearly 40% of Rockford's violent crime rate at any given time is domestic related. And so we started to ask what's going on in these homes, what's happening with the youth in these spaces. And what we discovered through an analysis over 5 years was that between 2016 and 2020, 65 to 75% of all of our violent youth offenders that were being arrested by the Rockford City Police Department were in fact cross-referenced in police reports as being either victims of or witnesses to domestic or sexual violence.
So the cycle just continues. The kids are abused and they become abusers when they get older.
It's even more broad than that. It's the exposure to trauma. Whether or not they were actually the recipient of the abuse wasn't a factor. It was the exposure to it at all in the home, and the trauma that ensues from that. And the fact that so often that trauma goes unmitigated and uninterrupted, and as any human being, as an adult, if I experienced that sort of violence, or whether I received it or observed it, that's traumatic. And going to work the next day, going to school the next day, and just going on as though nothing happened is impossible. And so what we are finding is that so many of our children are manifesting this trauma on the streets in our community in the form of violent crime.
So how do we help those kids?
We address it directly. We first of all have a community conversation around the root cause of our violent crime, and we do not believe that we need to look any further than to domestic violence and the results of that on our children. And we start talking about that in spaces where children are, primarily our school district. What are we doing during the school day to make sure that those children who are acting up in a behavioral outburst or a behavioral way are getting connection to meaningful resources on the spot within that building so that they can interrupt that trauma? In the juvenile system, in the juvenile court system, what are we doing at the Juvenile Assessment Center when youth are first being brought in? What sort of mentorship, therapeutic programming, and others that can we enroll them in to try to interrupt that trauma and prevent their further entry into the criminal justice system?
So what kind of programs are there to help these kids?
So there are direct programs that really, everything that we are trying to do involves data-driven whole family wraparound services. And so if a youth, for instance, at the Rockford Family Peace Center comes in with a parent who has experienced domestic or sexual violence, one of the first things that we do is offer through one of our youth grant programs is offer an opportunity for that child to in fact become their own client at the Peace Center. They are able to receive child play therapy. They're able to receive therapy in general, whether or not it's play or not. And they're allowed to and really enrolled in a whole family wraparound service delivery model that includes what mom's needs are, what dad's needs are, what caregivers' needs are. And so there are 2 different grant programs at the Peace Center that do that. In addition, at the Juvenile Assessment Center, we're working very closely with our partners there to analyze what current programs and diversion programs are offered through the courts. And we're really discovering that we have a lot of opportunities where we can embed mentors and meaningful connections within that building. And so we're working towards identifying the best practice to put in place there. I have to say that our partners in the Juvenile Assessment Center and in the courts have been phenomenal to work with. They have really accepted this process of analyzing their work and really evaluating the outcomes with the intention to be an improved response.
Who are some of those partners?
So besides the Juvenile Assessment Center and the courts, Youth Services Network, the Carrie Lynn Children's Center, those 2 have been primarily our youth partners. Youth Services Network actually has 2 people embedded in the Family Peace Center right now full-time, a therapist and a family navigator that also can do outreach and goes into the school buildings with us. Whitney Simpson at the Family Peace Center and Annie Hobson actually go into schools around our community and really try to interact and engage with children in a very organic way to try to then understand and learn what's happening in each of their homes and then get them some referrals two partners in the community that can provide those services. We also have to talk about our partners outside of the Peace Center at the Park District and at the YMCA and at the Boys and Girls Club. So we're working with those organizations very closely to really take a look at their current programming and figure out where we can embed mentorship and therapy. Those are the two key components that we feel like we've got some work to do community-wide in getting better at. And so today, as we're sitting here, our brand new pilot program for mentors has been launched. And so we're training about a dozen to 24 individuals at the Park District right now on mentorship, how to watch for signs in youth for trauma, and then how to intervene in those spaces, and also just be a person for that child, be a caring adult in their life. And those Park District employees are going to be embedded into two new park program sites that we're launching this summer, where we are actually building the components of recreation, education, which were already there through the Park District, but then also therapy and mentorship.
Sounds like there are a lot of moving parts,
There are
a
a
lot
ton
of
of moving
pieces.
parts. There really are. We have a grassroots coalition that we seeded this past fall. So we have people with lived experience who are meeting with us every other week, evaluating where we are, ideas that we're floating out to try to get some direct resources to our youth and families, and really giving us feedback of, no, that won't work. Or no, that won't work, but maybe this will. We're holding community listening sessions with youth in all areas of the community and really trying to go where children and their families are to learn from them what we should be doing differently. We cannot continue as a nation or as a community to sit in boardrooms and make these decisions independently. If we do not bring the community into those spaces and let their voices influence our work, we're going to be having the same conversations we are right now in 20 years.
So you mentioned the national aspect of this. You know, I can't imagine that Rockford's unique in this problem, but it sounds like you've got more of a different approach than maybe some other communities. What other communities are doing programs like this?
You know, I am not aware of any other community in the state of Illinois or nationally that from the mayor's office is launching a citywide initiative that's really creating a public safety framework that requires other entities to evaluate their response to those in need. I just don't know of one. I think that we are very unique. I think that we're unique also in that we have fantastic partners in this community, and the vast majority of whom have come to the table and said, please, let's evaluate what we're doing as well. We know we can be doing better. How do we improve our response? And that's what really, I think, makes us unique. You're right. These aren't unique problems to Rockford. What's unique is this collaborative response.
Well, it sounds like you've got a handle on the situation. How many children are we talking about? How many children do you serve in a month, a year?
So just to give you an example, when we talk about our Handle with Care program that we worked with Rockford Public Schools to launch this past spring, we know that from mid-February to the end of the school year, and so Handle with Care simply is this. I'm on scene at a traumatic event, and Rockford City Police arrive on scene, and they note in their report, Jennifer Ketchpalia, Rockford Public Schools. And so what happens then is an email goes to Rockford Public Schools saying, Jennifer Ketchpalia, Handle with Care. And so then the principal of my school gets that notice in the morning. That's all it says. It doesn't say who, what, where, when, or how. It's just something traumatic has happened to this child since you last saw him, her, or them. Be on alert. And then that message is funneled down in the school buildings, ideally to social workers and therapists within the buildings. And so we know those notices from mid-February through the end of the school year, there were 900 notices of children in that time period that were exposed to trauma that was documented in a police report. And so we do have that data set for a number right now.
900.
900, and that's only on places where police were called.
Now, if a social worker or counselor within the schools sees a child that they think is in trouble, can they refer them to your office? How does that work?
They can certainly refer them to any proper programming, whether or not that's the Rockford Family Peace Center because there's been domestic or sexual violence very specifically, or it's the Boys and Girls Club, or it's Youth Services Network with their trauma clinic, or even OSF Medical Center has a trauma clinic as well. So what we're running into, though, is extraordinarily long wait lists. We have a need in our community, and I don't believe this is unique to us. We have a significant need in our community to expand and increase opportunities for mental health.
Well, yeah, we've been talking about mental health issues in this community for years.
Yes.
How do we expand those opportunities?
I'm very hopeful that the work being done out of the Mental Health Board is going to get us there. They are an agency and being overseen really by not only the board but Jason Holcomb at R1. And they are determined to develop a data-driven program that will allow us to measure and find out where we can do that very thing. I don't know the answer to that yet because it's just too early in the analysis of the money.
Well, it sounds like you're doing a lot of good work for a lot of children in our community, and I applaud you for that. Thank you very much for being on our program.
Thank you.
That's it for today. Like I said at the beginning, if you like our content, please say so on YouTube or whatever platform you're on. Subscribe to our channel. Thank you very much, and until the next time, I'm Wally Haas, and thank you again, Jennifer.
Thank you for having me.